So hello friends, welcome to my new video. So today in this video I will discuss with you all about a very common ophthalmic condition that we see in our daily OPD. So I'm talking about pterygium. Okay, so let's start. So what is a pterygium? So it's simply a fibrovascular overgrowth of conjunctival tissue over the cornea in a triangular manner. That's called a pterygium. Okay. So it is seen that rural population are more affected with pterygium than the urban population. Okay. So what are the causes of pterygium here? First of all, genetic predisposition. That means if suppose I am having pterygium, then my offspring can also have pterygium. There is a risk. Okay. There is genetic inheritance of pterygium can be there, or else chronic environmental irritation by prolonged UV rays exposure. Suppose someone is having its work profile like he need to travel in sun for a very prolonged time. So that person will be more exposed to UV light than a person who is doing indoor work for the whole day, like he is working in an office, and someone a traffic police he's in the sun for the for whole day. So that traffic police is more exposed to UV light than that office worker person. So ultimately, more UV exposure can lead to more risk of developing this pterygium. Okay. Another is prolonged exposure to dusty environment. So prolonged exposure to UV as well as prolonged exposure to dusty or sandy environment, all these things lead to formation of pterygium in a more faster manner than those people who are doing their work in an indoor. Okay. Now, why pterygium is more seen in nasal side of the eye? First of all, in our daily OPD practice, you also seen that most of the patient who came for pterygium removal or complain of mass lesion growth from the nasal to the cornea, black portion of the eye, you see maximum of those patients that pterygium is present in the nasal side of the eye. So what is the reason for that? So the reason is light fall more in nasal portion than temporal part, and when light fall on the eye, then because of the what to say fact that it is more fall on the nasal portion than the temporal, so this is why more exposure to the UV rays is the nasal portion of the eye than the temporal one. So this thing can lead to formation of pterygium in the nasal portion more than the temporal portion of the eye. Second, longer temporal eyelashes make the light transmission less in temporal side of the eye, and in the nasal portion eyelashes are very short manner. So this is the reason that light are getting more falling on the nasal side. Another thing, like tear flow from temporal side to nasal side of the eye. So tear is getting secreted from the lacrimal gland, and via the lacrimal duct it reach to the superotemporal fornix, and from there tear reach to the upper and lower marginal strip, and in every blinking tear flow from the temporal side to the nasal side. Okay, so if there is any foreign body irritate the eye, if any foreign body is there, then the foreign body also comes with the tear flow to the nasal side, and it irritate mostly the nasal portion of the eye than the temporal portion. So this is also one of the reason that pterygium is more seen in the nasal portion of the eye than the temporal portion. Another is, as the nasal side of the eye has two ciliary artery, but one ciliary artery is present in the temporal side. So this also can be one reason that there is two ciliary artery in the nasal portion of the eye, but only single ciliary artery in temporal portion. So any congestion, hyperemia, anything is there, that is more seen in the nasal portion of the eye than the temporal portion. So this can be one reason that pterygium is more seen in the nasal portion of the eye than the temporal portion. Okay. Now let's move to the next slide. So here in this picture you can see this is the most common type of pterygium, that is the nasal pterygium. This is very rare temporal pterygium, and this is bilateral pterygium is there. So whenever you see a patient of pterygium, do ask the patient about his work profile, that whether the patient do his day-to-day work more in sunlight or more sun exposure, something like that. Okay, so ask this question in the history part. Okay. Now, this is the pathophysiology of pterygium, where constant exposure of the UV light. This lead to insufficiency of the limbal limbal stem cells of the cornea. Because of the prolonged UV exposure, it lead to damage to the limbal stem cells, and ultimately this thing can lead to activation of tissue growth factor. So remember this thing very well, that why cornea is avascular, because in the limbal stem cell there is presence of VEGF receptor 3 that prevent blood vessel to grow over the cornea. As the eye is more exposed to UV light, in such person who are doing more outdoor activity, those people are more prone to have exposed to UV light than those people who work in indoor. So in those patients, there is damage to the limbal stem cells, and that lead to formation of growth factor, and ultimately this growth factor lead to conjunctivalization of the cornea. That means creeping of conjunctiva over the cornea in a triangular manner. So here cornea is invaded by aggressive fibroblast, and that lead to formation of pterygium, where you can see this is the pterygium formation. Okay, and here is the conjunctiva. So pterygium is mostly seen in the bulbar conjunctiva. Okay. Now this is the clinical presentation, where symptoms: the patient will complain of irritation, watering, foreign body sensation, and dimness of vision. Dimness of vision when there is obstruction to the visual axis because of pterygium, then the patient can complain that he is having dimness of vision. Otherwise, if the pterygium is not affecting the visual axis, then the patient will not have any visual problem, but he will only give you the complaint of irritation, watering, on foreign body sensation, or the patient may come for surgical removal because of the cosmetic appearance. That can be one reason. Now, signs here: a triangular mass lesion from the nasal side to the temporal side of the cornea, and no redness in the eye seen. Redness is seen in case of any foreign body inserted to the eye, or any inflammation going on. In this kind of condition, redness can be there, but in pterygium it's a very normal phenomena that happen because of the prolonged exposure to UV light, so that will not lead to any redness. Okay. Now, how to evaluate a pterygium? So you need to follow the following criteria. First of all, location. Where is the pterygium is located? Whether it is in the nasal side or temporal side, or it is present in the both side of the eye. Okay. Then you need to see the size. So whenever you see a patient having pterygium, then in the slit lamp examination part, do document the pterygium height and width. Okay. So it's very important to measure the height and width of the pterygium, and as well as whenever there is an ulcer patient, you need to measure the stromal infiltrate height and width, as well as epithelium defect height and width. Remember this thing very nicely, that do measure these things for the future follow-up easiness of the patient. Okay. Now you need to see the vascularity, how much it is vascular, and then you need to see the extent. Extent means how much it is long. That means if it is forming from this side, and when it is where it is reaching. So if this pterygium is only reached to this part here, limbus area, touching the limbus area, it is grade 1 pterygium. If it is in this portion, this is grade 2. If it is covering the visual axis, that is grade 3 or grade 4. Okay. Now, area of corneal involvement, whether it is covering the visual axis or not, that you need to look at. Okay. And presence of or absence of Stocker's line. So Stocker's line is a browny pigmented line just anterior to the cap of the pterygium. Okay. So that you need to mention it, that whether there is presence of Stocker's line or not. Okay. So here these are the part of pterygium, where cap, head, neck, and body. Okay, this is the cap, and this is the head portion, and this is the neck, and this is the body part. Okay, so here whenever surgeon plans to remove the pterygium, then it can be done in two ways. Whether the surgeon can remove whole the pterygium, or the surgeon can plug the pterygium head from this part, and he will switcher the head in this part only, okay, so that the pterygium will not get progressive manner. Okay, now differential diagnosis of pterygium. So here ocular surface squamous neoplasm, this is the eye cancer you can say. So this ocular surface squamous neoplasm is somewhat looking like pterygium because of this kind of nodular formation towards the cornea. So here the most important thing that you need to look at is whenever you are seeing this kind of patient, then uh, do rose bengal stain to this patient, because if there is dead cell then it will definitely get stained by rose bengal. So stain the patient with rose bengal, as well as you can see the feeder vessels. But in pterygium you will not see such things. Okay, you will see only this kind of triangular mass going on. So if you match or compare this photo with this one, then it is very different, as well as you will not see the cap, head, neck, body portion, anything. Okay, so this is how you need to differentiate between OSSN and pterygium. So first thing you need to do is to differentiate, stain the patient with RB stain, rose bengal stain. Then second, see the feeder vessel presence or absent. Here a feeder vessel is present. And also in pterygium you will see head, neck, body, as well as cap, Stocker's line, but here nothing like that is there. Okay, and pterygium is mostly seen in nasal part, but this can be OSSN can be there in any part of the eye, in any 360-degree. So this OSSN in severe stages it can be elevated in a nodular manner. So this is the feeder vessel. Okay, so this is how you need to differentiate. This is symblepharon. So when symblepharon is forming, when there is ocular surface keratinization is there because of surface dryness or anything such kind of thing, or chemical injury, then the bulbar conjunctiva and palpebral conjunctiva get attached to each other, and that is forming the symblepharon. Okay, so symblepharon is the adhesion between bulbar conjunctiva and palpebral conjunctiva. So it is also look like pterygium, but it's not pterygium. So it is mostly seen in inferior portion of the eye, but pterygium is not seen in inferior or superior. It is mostly seen in nasal temporal side. Okay, so here this thing that you need to look at, so that is known as pseudopterygium. So pterygium is a condition that cause fleshy overgrowth of the conjunctiva in the eye, while this pseudopterygium is the condition that cause adhesion of the conjunctiva to the peripheral cornea. So this pseudopterygium happen after an eye injury, where there is damage to the corneal limbus cells that lead to adhesion of conjunctiva to cornea. So this pseudopterygium, here you will not see head, neck, body part as we see in actual pterygium cases. Pseudopterygium is just the proliferation of bulbar conjunctiva over the cornea after injury that lead to loss of limbal stem cells. So this pseudopterygium can be present in any side of the eye. It can be present in any part. That means 360-degree. But pterygium is seen in only nasal part of the eye, or rarely in the temporal part or bilateral nasal temporal side. But it will not see in superior inferior portion. Okay. But you will see the pseudopterygium in any part of the eye. Okay. Now this pterygium in OCT, here this is the AS OCT performed. Here you can see no plane of junction between the lesion, that is the pterygium, and the corneal epithelium. You will see no space is there or no plane. But in case of pseudopterygium in AS OCT, you can see that overgrowth membrane that is not attached with the underlying cornea, and there is a gap. So this plane of junction between the overgrowth and the corneal epithelium. So this is indicating that it is not actual pterygium, it is a pseudopterygium. Okay. So why pseudopterygium happen? It can be due to corneal burn, ocular circuitry self-amphicoid, Stevens-Johnson syndrome, or pterygium marginal corneal degeneration. This thing can lead to formation of pseudopterygium. So here, how to manage a pterygium case? So if pterygium is not covering the visual axis, there is no need of surgical intervention. If the patient is concerned about the cosmetic look, then surgery can be done to remove the pterygium. And in case of irritation by pterygium, then lubricating eye drop can resolve the symptoms. Okay. So that's all, friends. Thanks for watching, and please don't forget to like me, to subscribe to my channel. I hope this video helped you a lot to understand more about pterygium. Okay.